Welcome to Mind Body Stuff. What is this? Our 16th episode now, I think?
It's a lot.
It's a lot. We got a lot more. We got a lot of things to talk about.
We got so much.
We got a lot to talk about.
We got a list of stuff to talk about. Watch out.
Watch out. We're not going to solve any problems. We're just going to talk a lot. Anyways, hopefully you guys enjoyed last week's podcast on balance. Such cool discussions that came after this one. I think one of the most interesting questions that came from a couple of you is, how do we even know what balance looks and feels like? Like, how do you even know if you're in balance?
Maybe it's just a feeling.
A feeling of what? What does it feel like?
I think you feel like you're in harmony.
Yeah.
Like things feel balanced. You know, like when you feel imbalanced, kind of like if you're on a tightrope and you're like, whoa! And then you're like, I might fall off! That doesn't feel so good. But I bet when you're on the tightrope and you're totally imbalanced, it just feels totally synchronistic and easy. And yeah, exactly.
Of course, as I always do, I brought this question into my ULA experience. And I was talking about it in ULA 1 on Thursday, and I brought in the 4 elements. And as maybe some of you know, if you are in our ULA community on Facebook, I've gotten into astrology quite a bit lately, and one of the women that I'm interested in, and now I'm actually doing an online course from, she talks about, it's called the missing element. And so she basically is saying that a lot of us have imbalances in our elements. So we should all have, and this is kind of going into astrology, so I'm going to make it very simple, but different planets in different elements. And so there's 10 planets, and you want like between 2 and 4 planets in each element. Now, some people will have like 6 planets in one element, and that means they've got an imbalance.
It's probably
there.
Me.
So you might have like 8 planets in fire.
Yeah.
You may, and I actually have the program now where I can look up your chart and we can see, and it'll tell us how many
planets are in.
But this is normal. It's normal for people to just kind of naturally be inclined towards certain elements, but we ultimately do want to have this balance. But anyways, we can't really change where and when we were born and where the planets were at that time. But what we can do is take a look into our own lives and how can we find that balance within ourselves. And so I just brought it back to ULA 1, since ULA 1, the entire playlist, is based upon the elements and like letting yourself really feel grounded and safe and secure and centered. That's the earth element when we start. And then letting yourself experience the movement and the ebb and the flow and the emotions that may come up, and allowing yourself to cry and sweat and really tap into that water element. And then we move into the fire, and that's the intensity. There's a lot of core work. You're feeling physical discomfort, and you're pushing through, you're walking through the fire, and then ultimately getting to the air, the heart, the breathing, the calmness. And I think one of the reasons that we do walk away from an ULA 1 class feeling balanced is because of this. We're balancing these different elements in nature and coming back to that place of harmony, both in the body and outside of the body. So internally, and then externally with our relationships, our habits, our whatever else. And so I just thought, that's maybe one way that we can seek it.
Yes.
An internal way to seek it. Now that's not necessarily going to create balance in your schedule or balance in your relationships, but if we start at home and do the work at home, I find that to be a really useful tool to at least feel balanced internally.
Yeah, and I think that helps you then feel balanced externally.
Yes.
Where you can then be like, okay, now I can look at my schedule.
Because I feel safe, or like I can make decisions.
And I'm maybe okay letting go of my ego part.
Right.
Or I'm okay sitting still for a little while, or I'm okay being busy for a little while, whatever our imbalance is off that way.
Totally.
I think that's a really, because I know after I finish ULA 1, I do feel very like grounded and centered, and I feel like I do have energy to kind of focus on then the external things in my life.
Yeah, so I don't know. It is kind of elusive thing, this balance, though. So I really loved the questions and the discussions that came up. It was pretty fascinating.
It was pretty great.
We've had a request for this week's podcast, and in light of the suicides that we talked about last week, Kate Spade and Anthony Bourdain, and I think just the this topic of mental illness is really coming to the surface in our culture right now and in our society. And so we have had a request to talk about mental illness. And so I'm the first to admit that I am absolutely not an expert on this. You're closer to it, but
I would say I'm not an expert either, because it's such a broad field. So I think we're both coming at it as just
curious
women that are curious about it, and opening up the discussion for all of us to kind of talk about it and process it.
Yes.
In some way. So I think we have to start the dialogue. Maybe that's what these recent suicides have taught us.
Yeah.
And, we always should have been having the dialogue, but we often forget and are then reminded, like, oh, we got to remember this. This is big stuff.
Yeah, and I think the first and most important piece of this is removing the stigma.
Yes.
Like, I think no matter what, like, that needs to be changed. Nobody should feel ashamed or embarrassed or afraid to talk about the fact that they don't feel good.
They don't feel well mentally.
Yes.
And this was a great discussion Kaylee and I had yesterday.
Oh yeah, because I'm like, I don't know if I can talk. Like, I have no idea.
Yeah, and you're like, well, what is mental illness?
And I was like, well, how do you know if you're depressed or if you're in a phase of darkness? How do you know the difference? And B, I think you brought up some really interesting points for me. So will you just kind of talk about what you said?
Well, yeah. I think first off, after we had this discussion, I got triggered about, like, well, what is mental illness? Because it's, of course, I'm like, she's mentally ill, or, I'll use the term very, very loosely. And then I just realized, but do we say physical illness? When we refer to someone, it's not like, well, I've got a physical illness.
Totally.
Do you have a mental illness, Kaylee?
Right.
Because when you think of it in terms of a physical illness, that's such a broad topic.
I have a physical illness.
I'm like, well, what is it?
Right.
Is it a broken arm? Or is it the flu?
Right.
Is it a sinus infection?
Toothache?
Is it cancer? Is it lupus?
Right.
Right? It could be, it's just huge. And I think it's the same in mental illness too. It's just such a huge topic. And of course, there's mental illness where it's like, I don't feel good today. I don't know why. There's mental illness like, my dog died and I don't feel well mentally right now. I'm having a hard time processing it.
But is that mentally or emotionally? Because that feels different to me.
Well, I think in Western semantics, we tend to lump emotion into mental.
Okay.
Do you know what I'm saying?
Because me personally, I consider those different.
Yes. Yeah. And that's why it's like physical illness. Like, so if you say you have a sinus infection, I'm like, well, that's very different than lupus.
Right.
To me.
Right.
But obviously...
what does specifying it, what is the purpose of so when you say this, is it like we should be more specific when we say mental illness, or?
Maybe we should just be more aware of mental illness and the degree to which it exists for some of us.
Okay.
So,
I see what you're saying.
Don't you think, like, sometimes,
yeah,
I could be sad because my dog died, and that is a big deal.
But would you classify that under the massive umbrella of mental illness?
I wouldn't. I would say it's a situational. So, of course, it's going to take you some time.
So, situational depression or
situational? Just the situation happened and you feel sad now. But let's say 2 years from now, you're still like, I'm still processing the death of Roger, my dog. And you're not functioning, you're not doing well at work, or it's impairing other avenues of your life. Then I would be like, that's kind of that's interesting that that's still kind of in your way of just having a normal life, whatever that is, having a healthy functioning life.
Yeah.
I looked up on the American Psychiatric site because I'm like, what is mental illness?
Yeah.
And they have mental illnesses are health conditions involving changes in thinking, emotion, or behavior, or a combination of these.
Okay.
Mental illnesses are associated with distress and or problems functioning in social, work, or family activities.
Okay.
Mental illness is common in a given year. Nearly 1 in 5 U.S. adults experience some form of mental illness. 1 in 24 has a serious mental illness. And 1 in 12 has a substance use disorder.
Okay.
And then they go on to say mental illness is treatable.
Are they saying so? And then as far as treatable, like yesterday you were talking to me about like it could be drugs, or it could be talk therapy, or it could be
dance.
But I guess for me, what's the difference between like a mental illness where there is literally a chemical imbalance in your brain, correct? The imbalance exists in your brain.
Mm-hmm.
Chemical imbalance in your brain where no matter what you try, try everything that you can.
And change my diet.
You've done a bunch of healthy things. You've
volunteered.
Worked on it. Yeah. You get enough fresh air. You eat healthy. You have healthy relationships, and you just still don't feel right. Isn't like that to me when it requires when there is an actual chemical imbalance in the brain, you need medicine to help get you balanced again,
right.
And I think there's nothing to be ashamed about if you have to be on antidepressants or anxiety meds
or mood stabilizers.
Yeah.
Well, I mean, any of that stuff. I'll give a good example of this. So my father, when he hit his 40s, got to a point where he wouldn't get out of bed.
Okay.
And he was a totally pretty happy individual, successful, nothing going wrong in his life, one would say. If we look at the situation happening in his life, he's happily married, he has 2 daughters, he's doing real good. Job is great. And one day he says to my mom, I just can't get out of bed. I don't want to. And this happens for 6 months. He stays in his bed. He doesn't want to work. He doesn't want to do anything. So, of course, now everything's being impaired. His relationship is impaired. His work life is impaired. His personal relationships with his friends are impaired. And so they start talk therapy. They start doing like vitamin B12 shots in his blood.
Yeah.
And then finally they're like, let's start you on an antidepressant.
Yes.
And he started the antidepressant. And within probably a week or 2, he was like, I can go to work. Because he had an imbalance in his brain. And he stayed on that antidepressant for the rest of his life.
Okay.
He tried to stop a few times, and it would come back. And so then, and that's the test too. I have clients where I'm like, maybe stop. Because they'll say, I want to stop. I'm like, go ahead, stop, try it. And they'll be weaned off by a medical physician. But then if they come back and they're like, I don't feel good still. You know, it's just, it came back. I'm like, well, then at least you know. And that's totally fine.
Yeah. And for me, I am coming at this from a perspective of not having had a chemical imbalance that needed to be treated with medication. I have been in times of deep darkness that I felt, I mean, definitely quote unquote depressed, but maybe not chemically imbalanced. And I can't guarantee this because I never tried, but I don't think antidepressants would have taken the pain away.
Yeah. And
because I think what I was suffering from was a period in my life of darkness. And I think I'm wondering if we can talk about the difference between like depression and just like darkness, because what you said to me yesterday is you said something like, well, think about it in these terms. If there is an event that you can identify, then maybe it could just be a time of darkness where something really, sad or hard has happened, and you need to kind of give yourself time to go through that process and grieve or whatever you need to do. But you said that sometimes with depression, you could be like, man, I have a fantastic job. Like, I have a healthy and happy marriage. Like, I'm not, I don't know. I just don't know why I can't be happy. And that made a lot of sense to me. Like, is there an event that happened that you are healing from, or that you have trauma from? Or is it just kind of like, man, like maybe like your dad, one day he's just like, I can't get out of bed.
Mm-hmm.
Nothing is necessarily wrong. Nothing happened, but I can't get out of bed now.
Right. And if you were working with you or him, like the first thing would be to be curious about an event.
Yeah.
Like,
Yeah.
did anything happen recently? Now, a lot of times clients will be like, nothing happened. No, I feel fine. But then you'll work with them a little bit longer and they'll be like, actually, my mom died 6 months ago. And it's like, oh, that's kind of a big piece to know in terms of how we're going to treat and how we want to work with this, versus someone like my dad who had no precipitating event whatsoever. And many times as individuals, we forget about the precipitating events for whatever reason.
Well, I think it's just a way to naturally protect ourselves.
Yeah.
To not be thinking about the trauma every single day.
I don't know what it was.
You probably have to just kind of...
You have to kind of drum it up.
Yeah, you got to bring it back.
And they're like, don't drum it up.
Don't drum it up.
I don't want to drum it up.
Not think about this anymore.
Yeah.
Sure. And do you feel like, and maybe, again, you guys, I just really hope that I don't say anything that feels offensive to anyone who is on medication or does have any type of mental illness. I am just purely curious about this topic right now. But like, do you think that drugs are prescribed too frequently or not frequent enough, or?
I don't, it's hard for me to say in terms of, because I know with my dad it saved his life.
Yeah.
And I think for other people it doesn't always work.
I know a woman and her grandpa committed suicide, her dad was suicidal, and she just knew that she was going to be on antidepressants for the rest. She had to, and there's no amount of personal work that she could do that would change that fact.
Right.
Now, I don't know if in some cases, if doctors are quick to just give you a pill to kind of numb it out, because one of the things that you guys know about me is I am interested in exploring the pain. Mm-hmm. But again, that's not always going to be beneficial.
Right, especially...
It may not help. It may not help to process what, or even if there's nothing really tragic that happened, then it's kind of like, well, you can get out of this. You don't have to keep digging around.
Right,
I
don't know.
Let's get you better.
I've dug deep and there's nothing there.
Better.
Yeah, that's right. It's like, that's okay. You've been digging a long time, buddy.
Exactly.
Yeah, that's right. I want to read this piece. I posted on my Facebook page. It's an article written.
Yeah.
And it's by Steve Safran. And it says, depression isn't sadness and suicide isn't a cry for help. But he has this great analogy that I think really spoke to people. For people, talking about people that are clinically depressed now, okay? So he says, suppose you're born left-handed in this predominantly right-handed world. Suppose that was considered okay from time to time, but generally not an excuse to use your dominant hand. Righties would say, why are you using your left hand? Your right hand works perfectly well. Or, I had a cousin who was left-handed, but with a lot of work, he forced himself to use his right hand.
Totally.
Or, why not just use your right hand? You wouldn't need the special scissors. But I'm still a lefty, you'd say. I'd like to be a righty, but everything comes out all wobbly, and it's so uncomfortable. Can't you just understand I'm part of the 10% of the population that is left-handed? Mm-hmm. And that's so because for those of us that suffer from clinical depression, you can tell me to do a bunch of stuff.
Totally.
And I will try and do it. Mm-hmm. I will volunteer. I will get active. I will get physical. Mm-hmm. I will change my diet. All those things. Yeah. And I will still dread waking up in the morning.
Yeah.
I will dread it.
Yeah.
I will have great relationships, great friends, great partner, and I will dread waking up that next day.
There should be no shame in just needing to take medication that will help your chemistry be balanced.
Exactly. And for those of us, like I love today, one of our participants posted about her battle with her mental illness. It's a long-term battle, and how she posted this great picture, and she said, here I am, and the picture was just these really sad eyes.
Yes.
And she said, it was a great photo, and it kind of captured her, deep sadness or deep depression, and she's so thankful that she feels better now. But I think it's good for all of us to share that story if we're dealing with clinical depression or clinical anxiety or any of the other mental illnesses, to not have stigmas, to be able to talk about it, to bring it into the light, to make sure we normalize it, so that if those of us are feeling like we can't make this next day, we see someone's story and they're like, and I'm like, oh my gosh, okay, at least it keeps me here one more day, perhaps. But with the stigma, it's so hard for us to talk about.
Why is there such a stigma?
And we're so okay with I have lupus.
Oh my gosh, people are so quick to medicate physical stuff.
Yeah.
Constantly medicate physical stuff.
No, I do. I'm always like, can I have an antibiotic?
you love those antibiotics. But yeah, so where do you think this stigma came from?
I don't know. I mean, it must seem like we're weak or something. Like you must be a weak part of the herd.
But it's so interesting because it's like, why wouldn't that cross over to physical stuff too?
Physical stuff is so actually not always is, but usually it's visible in some way, like, oh yeah,
not usually, like high blood pressure, or think about how many Americans are on prescription drugs. It's like a crazy
oh my
thing.
God, for all their physical illnesses or bad kidneys or
a lot of things you can't see, so I don't know why. I don't know. Where did the stigma come from?
I don't know. It's definitely not. I mean, maybe you guys know. Maybe someone has a great idea out there or has studied it more. But there obviously is a stigma. And I think we're getting past it. I hope we're getting past it. I mean, some of us talk about it a lot.
Yeah, and I do think that, this awareness, just with these, two very, very loved people committing suicide last week, I think it has felt a little bit like a wake-up call.
Yes, and we make the mistake sometimes with certain mental illness that we think, successful people don't feel that.
Yeah, but again, it's like exactly what you said. It's like when you look at the person and you're like, well, you have all of these boxes checked as to what we consider a happy life. So why can't you just be happy? Well, because it's an imbalance.
Right. There's still, it's almost like
not anything that you can do or can't do. You can be as successful, you can be as loved, you can be whatever. But it's if you have an imbalance,
yes,
then you can't. I don't know. You're not going to find the joy or
it stops us from reaching out sometimes, just eats us up. It tells us things, don't reach out. You're worthless. It's always that voice, that depression or that anxiety is a voice in the sort of sitting on our shoulder.
I haven't had, I wouldn't, like I said, I went through a really dark period, but I think that was obviously situational. But I've gone through serious anxiety. And I guess the way that I would describe the anxiety that I felt was, it was a cyclical pattern of thought that once I entered into the pattern of thought, it was like I was on a bicycle.
Like
and
a
I
treadmill.
couldn't get that, a stick in the spoke to stop it. And I would feel it when it happened, and I'd say, oh God, here we go.
Yep.
I can't get out of this spinning cycle of thoughts.
It's like that brain loop.
Just the brain loop.
Mm-hmm.
And I tried I tried a ton of things, and eventually I've gotten it more under control. But man, the way that it made my entire body feel just so tense, and just I can feel the feeling in my gut, just kind of remembering that anxiety.
And how cool when you said you would notice this cycle of thought is starting now.
Oh yeah.
And now I'm going to get stuck in it for a ways.
And then I'm like, oh, here we go.
Right. Yeah. Which is, it's interesting how the brain is doing that, right? Versus you even logically telling it, now you need to stop.
To be honest, ULA really helped, because I would notice, I would say it was between 5 and 7 years ago that I had pretty bad anxiety. And ULA was one of the only places that I could really get it to shut down for a while, for an hour every day. And I just remember at the end of every class being like, I needed a break from those thoughts.
Mm-hmm.
Like I needed to stop that pattern of thought,
Mm-hmm.
you know, and then it would eventually kind of creep back into my thoughts. But but again, see, so then this is where I'm confused, I guess, in myself. It's like, I never took anti-anxiety medication. Maybe I could have, and it would have stopped it. But then I had to turn to like meditation. I had to get out in nature, and I had to find a tool. So does that mean I didn't really have anxiety? Because
No, you probably did have anxiety, but you did have anxiety, and of course it's all different levels, you know, for any of us.
Is anxiety a chemical imbalance? Because if I could figure out how to stop it without treating it medically, then was it?
Of course, you can train your brain. You know, there's all those research studies now that they're figuring out with placebo stuff,
Sure.
and where
It's all very confusing.
And it is confusing because it's you know, it doesn't really, it's not something totally logical. Like, well, this happens and then I give it A, or this and then I give it B.
And like what my cycle of thought was totally like irrational.
Yes.
And it was like a worry of something that I wasn't even it wasn't even necessarily going to happen.
Right.
You know, it's just this like constant worry of these like, you know, whatever. So,
yes. Yeah. And then, but one would say you were anxious at that time.
I was.
For whatever reason.
So I wonder.
And you're probably shooting out a bunch of something. You know, there's something like something triggers it, and then you shoot it out, and then it keeps the brain and the whole body kind of in that cycle a little bit. And then you had to figure out a way to kind of stop it.
Yeah.
Or or shoot something else out.
Yeah.
You know, that sort of balanced it.
Uh-huh.
I mean, I became an agoraphobic.
Yes.
After I had my daughter, my first child. And that was unusual for me because I was.
Can you tell them what that means? I wouldn't have known unless you told me.
An agoraphobic means I was afraid to leave my house. Mm-hmm. So it lasted for about a year. And you could say that might have been caused by the changes in hormones, did something to the brain chemistry, and it created this sort of vicious, it was a very unrealistic anxiety too. Like when I tell it now, it's like, what's your problem? But again, that's the stigma.
It's unrealistic,
That's the stigma, right? Because I can't make sense of it. Maybe that's it. Maybe that's it. Because in physical illness, I can say like, yeah, your kidney's pretty bad.
Right.
Like, I can see it.
Right.
But sometimes with mental stuff, I can't even measure it. Like, it's more like, I feel this way, and someone's like, that's kind of odd.
Right.
So mine was, I had this intense fear of fainting in public.
Oh, so that means you're afraid to leave the house.
Yes.
Because you thought you might faint in public.
I might, and who cares? Hello, everybody. Like, part of me now looks back. I'm like, what does it matter if I faint in public?
Right.
But it became a complete phobia.
Yes, sure.
I cannot faint in public. So what would happen? I'd go out, and right away I'm like, I'm going to faint.
Yeah.
And you know, I think it was triggered. This is interesting because I always look back at the trigger. After I had my daughter, I developed sort of low blood sugar problems, which I hadn't had before. I could, you know, not eat for a long time.
Because you used to starve yourself.
Used to starve myself. I was anorexic. But
you got a lot going on, lady.
Got a lot going on there. But my body fixed that for me in a strange way. So I had my daughter, and then I had my first episode where I got low blood sugar. And we were out, I remember, and suddenly I'm like, I'm going to faint. And we had to order food right away. And it was very upsetting to me to feel kind of out of control, and everyone kind of helping.
Helps you.
Like,
you don't like that.
And they're all noticing me. Like, don't notice me. Yeah. Like, let's just go around or just give me a hot dog, okay?
Yeah. A hot dog. Just somebody get this woman a hot dog.
Give me a hot dog, I'll be fine. So that's how it got triggered. And then it got anchored somewhere in there. Yeah. And then it was like, this is what's going to happen.
Yes.
And then I couldn't go. And then the anxiety slowly became more and more powerful.
Yes.
So first it was like, well, I just can't maybe go out with friends. Maybe that's when it will happen. But then it eventually became where I couldn't even go to the grocery store. And my husband was so good. He was like, but there's tons of food in the grocery store. Like, you could just grab it and eat it.
Off the shelf.
And I'm like, no, I can't. It won't work. And so I became agoraphobic. I couldn't leave the house. I tried medication during that time.
For what?
For anxiety. Trying to tone it down. But of course, when you take medication, sometimes you don't feel good either because it doesn't feel like you.
Oh, sure.
For me, I'm like, who is this? Now I'm kind of like, my name is Bernice. You know, everything was kind of slow. And I still kind of felt anxious, too. But eventually I tried a practical, and I think actually my hormones probably leveled out about a year later.
A lot.
Like, I wish we'd spend more time in our medical profession researching that type of stuff.
Sure.
Because within a year, it started to level out. And I did this thing where, okay, so I'm afraid of fainting because of lack of food. So I would just bring food everywhere. Yeah. I would have food just stuffed in my pockets.
You still do.
I still do have food. Not as much, but I still do.
You do. And it's usually sugary.
It's usually sugary food, yeah. Yeah, and I kind of learned, like...
You got to have your sugar with you just in case.
Just in case. And then eventually I sort of taught my anxiety, because we had a dialogue. What do you need? What's going on? I wish I had some food. You got food right here. You got a loaf of bread in one pocket.
A loaf of bread in a pocket?
I used to bring a loaf of bread.
How did it fit in
your pocket? And a jar of peanut butter in my other pocket.
In your pocket?
I had big coats on. Or sweaters. Is that mental illness?
Oh my god.
I have a great story.
That's hilarious.
I traveled with a friend. It was like my first time traveling. She thinks it's really funny.
Why didn't you just make a sandwich?
This is awesome. My first time traveling with a friend after this whole agoraphobic episode. My friend Peggy, if you're listening, Peggy.
In your pocket?
So we go to Canada to buy horses at the time. We're into riding horses professionally. And she tells this great story. She's like, I knew it was strange when we went to a restaurant, and then as we're waiting in the lobby, you pull out a jar of peanut butter and some bread, and you start making a sandwich before we go eat dinner. And I'm like,
oh my gosh.
Yeah. But,
but it helped you.
It was like it gave me a logical way.
Yeah.
Like, here you go, body.
Anxiety, look, it's taken care of.
Yes.
Right.
I had another client. This is another good story about anxiety. He was a professional skier, skied all his life, and suddenly he got terrified of the chairlift.
Oh wow!
Suddenly terrified.
Oh,
and I'm like, what?
And there was no trigger.
I don't think there was a trigger. It just developed. He just developed this intense fear of the chairlift, which was problematic for a professional skier.
Yeah.
So I was like, well, what can we do? And I'm like, what if you carried a rope?
Oh, smart.
And you just carry it in your backpack or whatever. And he was like, a rope? And then he came back a few months later. He's like, yeah, I carry my rope everywhere.
And it helped.
I can get off. If I have to get off, I can get off that chairlift.
Yeah.
And so he could go back to skiing.
Wow, how interesting.
Yeah, it was like, well, there's
good job, detective.
How about a rope?
That's awesome. Wow.
Yeah, then he could ski again.
Yeah. Man, anxiety, I mean, yeah, like I said, I haven't felt depression, but the anxiety, it sucks.
Oh, yeah. And depression, too,
Oh, yeah, God, yeah.
Or whatever, any of the mental illnesses.
And, even going up to, like, schizophrenia,
the psychoses
are
huge.
Oh, my gosh, I just feel so sorry for those people.
Yes, it is.
Ooh.
It's a long journey. Some of our most creative people are dealing with those types of mental illness.
So, one thing I was thinking about, why do you think it is that artists may suffer? I don't want to say more, but a lot of artists have some degree of mental illness
or darkness or something.
But then again, it goes back to my question: is it like just this darkness, or is it like a chemical? Like, and
what
maybe
is
it doesn't matter. Maybe
it doesn't matter.
Maybe it just doesn't matter.
It doesn't matter.
But I guess for me, it's like, is the treatment medicine or is the treatment something else?
Really, isn't it based on the individual?
Yeah.
So we would be like, Kaylee, let's try this first.
Try it.
Yeah, let's try exercise. Let's try diet. Let's try meditation.
But do you think that there are enough people, and I guess this goes back to my question, are most people more likely to just start with the drugs, or are more people likely to start with other other options?
Well, I think this is where you pick your doctors and your caregivers carefully, and they match you in terms of what you think would work for you. Because ultimately, you're the expert on you. You know, you kind of know what you want, or maybe what you want to try. And that's okay.
But I think, and we were mentioning this yesterday when we were just kind of talking about this, you're just such a huge proponent for advocating for yourself in the medical world, and even in the the health world in general, mental health or physical health. But you always are talking about like the personal advocacy as a patient.
Yes, and you are the consumer. Let none of us forget that. We are the consumers of these doctors and these psychiatrists and psychologists and counselors. So make sure you have every right. If you work with someone and you're like, I do not like that person, or that did not feel good, I just don't feel maybe just a rapport with that person, that is fine. Go find someone else. It's kind of like I say, it's kind of like buying spaghetti sauce at the store. And maybe
spaghetti
sauce
at the store. Dun, dun, dun.
Everyone's like, what is that? So, and you might have like your favorite spaghetti sauce at the store, right? But you've probably tried a few of them. You're like, well, I tried this one, that brand. It was a little too spicy. This one was too sweet. That one's a bit salty. And eventually you find the spaghetti sauce. You're like, yes. It's like Goldilocks and the Three Bears. This sauce gets me. This is the same with our caregivers.
As long as they're like in our network, though.
As long as they're in our network. That's right. Unfortunately, given the insurance
to
stuff
and circumstances.
Exactly.
However, I think it's such a good point. I think we have given so much of our personal power away to the medical industry. We always think that the physician or the healthcare provider is the expert, but we also need to kind of remember that we are the expert on us. And as you said, we're the customer, we're the client, and it's okay to demand things or to ask for things. Like I've demanded tests that my doctor said, no, we don't need to do that. I'm like, no, actually we do need to do this. Actually, I demanded, with my first pregnancy, I had tons of blood clots, and I demanded to get tested for clotting disorders, and the doctors were like, no, it was just a fluke, you had placental abruption, it's just a fluke. And I was like, I need to be tested. And I found out that I have a blood clotting disorder. Now I have to take baby aspirin every single time I'm pregnant again, which is very good to know, which I would not have known.
Because that would have been problematic.
Yes, in consecutive pregnancies.
Yes.
And then my sister just got tested. She has the same disorder. And her doctor, I think it was like, well, make sure that you tell all of your daughters that they need to get tested for this
probably
too.
Genetic, right? Yeah, it's probably.
Because it's probably genetic. So I'm like, well, I had to advocate for that. Like, they said no to the test, and I said, yes, I want this test.
Yes.
But it's like you have to, I think you really do have to almost demand which course you want to take.
Yes.
And then
if your doctor's not receptive, then change your doctors. If you can, then change doctors. There's all this research. If you have rapport with your doctor, you will get better quicker. If you don't like your doctor, it's probably not going to work as well.
Interesting.
Yeah, there's all
about that.
You have to like your dog.
Oh, that's so interesting.
Really, if you don't like them, part of it's like, I don't really trust
your body's like rejecting.
I don't trust what you're giving me.
Yeah,
totally. Sandra, whatever.
Yeah.
I have a great story about medicine. I learned this the hard way because, of course, I suffered from anxiety after Joe was born. I had my heart tested, and because my heart rate was always elevated.
Yeah, sure.
And they were like, oh, yeah, your heart rate is just, you have tachycardia. It's always kind of racing. And it's a type of tachycardia. I can't remember. And so I see a heart doc, and he's like, we're going to put you on this medicine, and it's going to make your heart rate just average, just normal. Just go bump, bump. Even if you're nervous, it's just going to keep it steady. I'm like, okay, great. We go home. I start the medication. It's like maybe the third or fourth day on medication, and I'm lying on the floor watching TV. And my husband's next to me, and I go over to him, and I'm like, my heart is way faster than it's ever been. And he's an EMT, so he gets my pulse. It's 220.
220?
And I'm resting, watching TV.
Oh, my God.
So he calls the emergency room, they put him in touch with the doctor, my heart doctor, and I say to my husband, I'm like, I think it's this medication. I feel like I have no control over it. Mm-hmm. And the heart doctor says to my husband, that is not possible. You need to bring her in, and we're going to give her an IV full of it.
No, it would have killed you.
It would have killed me. And I didn't go in. I said, I'm not going in. I stopped the medication. I still have rapid heartbeat, but it's just my own rapid heartbeat. Uh-huh. And then we found out a year later, this is a new medication, 1 in every 100 patients that was given that medication had a heart attack.
Oh my God.
So I learned the hard way.
Yeah.
So I listened to my gut that said, no,
yeah,
you are not killing me today.
Oh.
And even though he thought he was doing the right thing, because with most patients, that medication works great.
99% of people
works awesome. But anyway, that's how we learn things. We listen, we build rapport, we find doctors and therapists that we have rapport with, and that'll help us in our physical and our mental health.
Mm-hmm. Yeah, and like I'm close with someone who just basically always has just never been that happy, even as a kid, just like not that happy. And she's tried so many things and has had this like, man, why can't I just be happy? Started antidepressants maybe a couple weeks to a month ago now. Feels amazing.
Oh,
so much better. So much better. But it's like she tried so hard to be like, there must be something wrong that I can fix,
and I'll power through it
with enough like self-care and with enough like really doing the personal work and like all of this
diving in.
I'm diving into it and figuring out like I'm gonna get myself better.
Yeah,
but she just couldn't. She just didn't get better.
Yeah, and that's like that left-handed analogy.
Yeah, it's just like
she was telling herself, I bet I could be right-handed.
I bet, yeah.
I can do it. I could make myself right-handed.
Yeah, totally.
And she
just needed the medicine.
Yeah, she's just left-handed. That's okay.
She's just left-handed.
We don't mind left-handed or right-handed people anymore. Yeah. We're like, that's fine. You're left-handed. I'm right-handed.
Yeah, absolutely.
And the world keeps going.
Yeah, it is interesting to think about like from the mind-body perspective. Like I think about my experience when I was kind of in the worst part of my anxiety, and like for those of you who are ULA instructors or who knew me a while back or who have seen the videos, like that's when I was like so wiry, my body.
Oh yeah,
and you can almost see the anxiety.
You almost look like it
in
your jaw almost.
Yeah, and like everything about me just didn't look very like relaxed or happy, it was like everything was just like you could tell I was in kind of a state of like
flight.
I was like kind of constantly in a state of flight, and my body really like I couldn't drink any coffee. I could not drink coffee.
Oh yeah.
And for anyone who knows me, like I love coffee. I couldn't drink it. Like I had to be very, very careful about stimulants.
Yeah.
Like it was really interesting.
That's anxiety,
but you see the effect that it has on the physical body too.
Yes, right.
And that's why I think having a breathing practice or just finding ways to let your body really slow down and to calm down the nervous system. Not that it can take entirely the anxiety away, but in my personal experience, it's been super helpful. Like whenever I'm kind of like just stopping, slowing down, and just focusing on my breath, taking a few really nice deep breaths, and it affects your nervous system. It affects, I think, even the brain.
Oh yeah, it does. They do measures.
Yeah, they can measure,
and it happens really pretty fast.
And for my for Huxley, like when she's really worked up about something, or when she's crying, where it's like they can't catch their breath, like we just always like in a calm voice say, Huxley, you need to take deep breaths, and then she can start to calm her body down, and then it calms her mind down, and she can kind of come back to this state of balance with the breath. I mean, I think breath work is one of the greatest self tools that we can use to help slow some of that stuff down. Again, I don't think it can cure but it's nice for us to have our little toolbox
yes
of things that we know are going to help. getting out in nature really helps me as well. When I'm feeling anxious, it's because I don't feel grounded. There's like, I feel like this like exactly what you just said about me. It was like I was like in this state of flight. And so what I needed to really do was figure out how to ground.
You don't have to fly today.
Yeah, like just getting out in nature, like going for a hike,
being part of the earth.
Yes.
Feet on the earth.
Yeah. So I think having our tools.
Yes, and always using them, whether we do have significant mental illness or not. You know, even with my father, he developed a very serious meditation practice, even with his antidepressants. All of that, and his exercise changed, and his diet changed, and all of that played a part in his healing process, so that he could participate in normal life.
In his life.
Yes,
absolutely, and enjoy it.
Yeah, exactly, and not be like dreading the morning.
I can't get out of bed.
Dreading the morning.
Yeah, absolutely. Yeah, it's such a complex topic, but I think if we aren't feeling good, we need to start exploring ways to feel better, and whether it's medication or whether it is, you know, tools or changes that you need to make in your own life. I don't think it really matters. It doesn't matter, but it just taking action and to not have the shame attached to the feelings that you have. Yeah. I think that's really important. I mean, no one should have to live in a state of constant like flight or constant just like
dread,
cloudiness or
dread,
dread and
it's like today
there's so much to live for that it's you know, I don't know, it's just so sad to think that there are so many people who feel ashamed to get the help. Yeah,
and even when they get the help, and it's hard to just reach past it and say, maybe it's not working right now in this way. And that's okay too. It's okay. And, you know, I hope you guys can continue this discussion on our Facebook page or however. You know, we love to hear from you and love to hear everyone's different viewpoints in terms of what they've experienced.
Yeah, just personal experiences.
Because it's so helpful to all of us to know we're not alone in our own journey.
Well, and so many times I think they're just not understanding, or ignorance is what separates us. Ignorance is what makes us judge one another. It's education and an understanding and then compassion is what unites us, regardless of who we are or where we from or where we from. Where you from? I mean, there's so many issues that I think we're experiencing as a society because we feel different from other people, and we're classifying people as different. And so when we can understand everybody is struggling with something, everybody is going through something, and when we have more of an awareness and understanding, it's so much easier to have compassion, to be able to relate, to be able to then help ourselves because we feel we're not alone in situations. I mean, just really I'm just really grateful whenever you guys share, even when it does feel vulnerable, and thank you to people who already share. Like you've referenced one of our amazing participants and friends, and it's those types of stories are hard to share. They are, but they are what's going to change the way I feel like we view all of this.
I agree. I totally agree.
So love you guys. Thanks for helping educate me as well.
Yeah, and thanks you guys for asking for this topic and letting us bring it to the light and just have a discussion about it.
Yeah, thank you as always. Love you guys.
Bye.